Good morning, PCOS Divas, and happy PCOS Awareness Month. I've been planning for PCOS Awareness Month all summer by compiling some of my favorite tips that you can put right into work in your life and really help to manage your PCOS so that you can feel better. And today's tip is to make sure that you have your labs done. And I know that sounds really simple, and of course, when you go talk to your doctor, you have blood work and lab work done, but it's really important that you understand what labs to ask for so that you can advocate for yourself. And I have compiled a PCOS Diva Labs Guide. Here it is. I printed it out and kind of bound it up for myself. But it has all of the labs that I think should really be like your baseline that you should ask your doctor for. A lot of doctors will only test, for instance, your thyroid level, your TSH, but you really want to advocate for a complete thyroid panel. You want to make sure that you get a baseline vitamin D. That's really important because so many women with PCOS are really insufficient in vitamin D, and that can affect energy and hormone production, and really it affects the way that we feel. So we want to get a baseline and make sure that we optimize it. So I know that for a lot of you, your doctors will kind of look at the list in my labs guide and might not be willing to do all of those tests. But there's also other options. Today we have a wonderful thing such as patient directed, I guess that's not the right word, but patients can actually advocate and get their own lab panels without a doctor's prescription. And I have done that through a really great company that I teamed up with to offer it to PCOS Divas, and it's called yourlabwork.com, and you can access all of my labs that I recommend at /PCOS Diva. So just want to get this right. It's yourlabwork.com /PCOS Diva. And you can also get food allergy sensitivity panels done. You can get the Dutch hormone panel test, which is a really fantastic hormone analysis, and I've done a great podcast about that with Dr. Carrie Jones, I believe her name is, and I will post these links below this video. But I really challenge you to get on top of your labs, and don't just take your doctor's word for, everything looks okay. Make sure that you advocate for yourself and ask the doctor's office to give you a printout of the labs, or go on the patient portal and print those labs out and put them into a binder so that you can kind of stay on track with how things are progressing. And labs are a great way to figure out whether your diet and lifestyle changes are working, whether the supplements that you're taking are making an impact on, say, your A1C, or your blood sugar, insulin levels. You can see whether you have low progesterone, which is really, I'm hearing more and more women that post on my private Facebook community a lot of period problems that I think are probably due to low progesterone. So that's something else to kind of track and look for. So thank you for everybody tuning in. Hi Nicole, hi Taylor, I love you both. And Nicole, that's so sweet what you said. Yeah, it's amazing what you can do step by step, these little kind of tips that I'm going to be talking about, and when you integrate them into your life, it is life-changing and it can make such a huge difference. So I'm going to be posting my simple bite-sized tips on Instagram and Facebook, and it is my plan to every day for the month of September record a Facebook Live to kind of talk a little bit more about the tips. So I hope that you're enjoying this beautiful holiday weekend. I'm about to go off to church with my family and then probably go grocery shopping because I've got my meal plan for the week and I'm trying to start my September off right and on a good foot. And usually that means getting to the grocery store to get the food that I need to cook healthy meals. So I challenge you September 1st to make a meal plan and get to the grocery store and enjoy your day, and I'll see you tomorrow. Bye-bye.